Welcome to the office. Welcome to the office, Frank.
Thank you.
How can I help you? What brings you here?
My back.
Where are you coming from?
North Orange County.
So what's going on with the back?
I've had problems with my back for about 15 years now. Yeah.
Okay.
And as I get older, I want to get stronger.
What happened 15 years ago?
Bottled water.
What do you mean bottled water?
Yeah, I was carrying a pack of bottled water, like 36 packs from our Arrowhead.
Picked up the bottle, you were bending over, bending forward.
Yeah.
Was it a bend and twist or just a bend?
It was actually a lift and twist.
A lift and twist.
Yeah, out of the trunk of the car.
So you were bending.
Yes.
A lift, bend, twist. Okay. Number one cause of low back injury. Number one mechanism of low back injury is flexion with rotation. That means bend and twist.
Okay.
In the books and in school, they learn the number one cause of low back injury is flexion
Okay.
with rotation. Now, there's also a 10-to-1 fulcrum distribution of weight in the L5 disc or the low back. Once you go past 45 degrees of flexion of the spine, the muscles go silent, the ligaments kick in. Okay?
Got it.
And so what happens? 10-to-1 fulcrum distribution of weight. So that 10-pound, 15-pound becomes 150 pounds. That 30-pound weight becomes 300 pounds. So that 10-to-1 fulcrum distribution is also very important when we're flexing more than 45 degrees.
I see.
There's a lot more questions I know they're going to ask later, but that's the science of it. So if we're carrying now this weight, we're flexing over more than 45 degrees and bending and twisting with that weight, it's a lot of weight on the L5 disc, if it's L5. If it's L5.
Yeah.
Okay, L5 disc can withstand up to 980, about 1,000 newtons of force before rupturing. I'm just giving the information. So you bend forward, you picked up some water, you twisted, you got a twinge in your back. Did you get any shooting pain down your leg?
No.
Okay. You went to your doctor or you went to a chiro?
Actually, I was incapacitated for 2 days afterwards. I couldn't feel my legs.
Both legs?
Yeah, so I figured I probably just pulled a muscle or something. So I just relaxed for like 2 days.
Okay.
Rug burns on my elbows.
I know that feeling.
Yeah.
I know that feeling.
Yeah.
So if you have no feeling in your legs for 2 days, it's really not a muscle pull, it's a nerve.
Okay.
Okay. A muscle pull would probably hurt more than I have no feeling in my legs.
Yeah, I had no feelings.
Okay, so then what did you do?
I had to crawl around for 2 days.
And then what? You were by yourself?
Yeah, I mean, eventually I got well. I mean,
Okay. All right.
so, but I was always very careful, guarded with my like lower back, lifting things.
Since then, right?
Yes, absolutely.
Okay. All right.
And
You were working, schooling, what were you doing back then?
both
Okay.
working and schooling.
Right on.
Yeah.
All right, so then you got some intervention?
Some.
Okay, what does that mean? They took x-rays, they took imaging, they
No.
told you what your problem was?
They didn't do that.
Okay, so what did you do?
Initially it was just maybe stretching, you know, a little bit
Icing or heating?
I think heating.
Okay.
And then one of the doctors recommended, or one of the chiros recommended that I go get an MRI.
Okay.
So I did that. He just said, you know, L4, L5, and there's a little bit of a bulge, and they couldn't do anything for me.
Interesting. So you just deal with it.
I dealt with it for a while, yeah, and then now it's just like,
And why now? Why here, why now?
I've been working out a lot lately,
Okay.
so I want to get stronger, obviously, with my age and stuff. So,
Okay.
yeah, I just want to be able to do, you know, CrossFit and
Okay. You want quality?
yes,
All right. You want quality first, hopefully.
absolutely.
But you know what happens with all the patients that come here? You're not going to be doing any of that for at least a couple weeks anyway.
That's fine.
It's walking.
That's fine.
And we need to figure out, we need to go over your x-rays when we get to it and explain kind of what's going on.
Sure.
Once I explain what's going on, I think things will make a lot of sense as to what's happening. But let's continue. So that's your number one issue of being here.
Yeah.
Any other issues?
I got plantar fasciitis on my right foot.
Okay.
It's been years and I can't get rid of it.
Okay.
Rolling it out, doing this, doing that. You know, I've gone through like 10 different shoe brands.
We'll talk about plantar fasciitis. Did you watch a video I talked about it?
No, I haven't gotten that far on the video list yet.
Let's talk about plantar fasciitis. Where does mechanical plantar fasciitis come from? Here's the foot, and that's the right foot, you're lucky. All right, we got 26 bones, 28 bones in the foot. Some say more, some say less, depending on how many sesamoid bones you count. Major misalignment. We have 6 major misalignments that occur with an inversion sprain. A lot of us have sprained our ankle, the majority of us.
Okay.
I'm sure you've sprained your ankle at some point.
Never.
We're going to find out.
Okay.
We're going to find out, okay? Now, the plantar fasciitis, in terms of mechanics, the way I was trained, it starts this way. The inversion or the twist of the ankle.
Okay.
Okay?
Got it.
Talus goes out, anterior superior goes forward. This is the keystone bone of the entire foot. 85% of all foot problems get resolved with that or are caused from that.
Okay.
The second thing that happens is the fibula will go posterior and can roll back. The more rolled back it is, we see that on an x-ray.
Got it.
Then we know there's also ligamentous instability in here. The third thing that happens is the calcaneus. Calcaneus is going to go posterior lateral. The next thing that's going to happen is the cuboid is going to go superior. The next thing that's going to happen is the navicular is going to go inferior. All of this sets up hypermobility of what we call the cuneiforms, the midfoot. And it's this bone right here, the second cuneiform. Okay?
Of all places in the middle.
In the middle, but here's the crazy part. It's a trapezoidal bone. And the only way it can go down to cause that plantar fasciitis is by fixation here, causing hypermobility here. And so it drops down, and that starts to rub on the plantar fascia. Follow my process.
Okay.
The fascia sits like that. It's rubbing on that right there. The misalignment of all this, we got pulling of the fascia at the same time. Okay?
So is that why the pain is in the back?
We're getting to that.
Okay.
This can develop a traction heel spur
Okay.
over time. So we have the fasciitis that starts from the alignment issue, number 1. Number 2, we can get a traction heel spur. That heel spur can develop a little bit more, and then it hurts to walk on the heel. And we need to see, is there a heel spur or not?
Okay.
So I've had quite a few patients in the past. They had heel spurs. They had 2, 3, 4 surgeries. Kept coming back. They're like, why does it keep coming back, doc? Because you didn't fix the cause. You're just treating the symptom. And all of it.
What is the what do you call it? What is the process to get rid of the heel spur surgery?
It all starts from the way I've taken care of it. It starts with the back, getting the power on, making sure our mechanics are right. All of that is the body's inability to do what? To go through its normal mechanics. Is the body smart or stupid?
Smart.
Smart. It's doing it for a reason.
Yeah.
And it's the big thing. Everyone thinks we have this symptom, we have that symptom, I'm sick, I'm this, I'm that. What's wrong with me? Nothing's wrong with you. Your body's smart. So if your body's smart, it's adapting. So the question is, why is it adapting? Because we're out of balance. It's that simple. So let's figure out what's out of balance. Cool. Fair enough?
Fair enough.
So we have low back. We have low back pain. We don't have shooting pains.
No.
And we have potential plantar fasciitis.
Right.
Got a new buddy over there. We haven't named him yet. We're looking for some names. You guys want to help name this guy? He's my new associate over there. We need a name. So
He looks like a.
somebody said a Harry.
Yeah. He
Frank?
looks like a Harry. No. He looks more like a John.
A John?
Yeah.
All right.
John Doe.
John Bones.
That's a good one.
Something like that. I don't know. You guys think of something. All right, you ready to get started?
Let's go.
Let's do this. Side profile, we're looking for curvature first. Do we have the right curves? 60-degree reciprocating curves. The neck curve should curve forward, curve back, curve forward. The second thing that should happen is we're looking at the posture line. And the posture line is we're going through the center of the L5 or lowest lumbar right here. It should bisect 7 and 2. Yours actually bisects, so that's some good news. So your shoulder is at least in balance. This is slightly forward just a bit, but your shoulders are in balance with your hips. So that's the good news. Let's look at the right side, okay, and let's talk about this. And I didn't do something on purpose. I did not mark the pelvic, do the pelvic analysis. I decided I was going to do it today with you and with everybody to watch how we actually do the analysis.
Okay.
All right, so this is looking at you from behind. Okay. Now, here's an interesting finding. you're finding the first thing we see is something is off on the lumbar. We typically have 5 lumbars that move, okay? In 10% of the population, we have 4 or 6 due to transitional vertebrae. You have 6 in your case, meaning, and let me explain what that means. It doesn't mean you have an extra bone. It means something developed different, and it's in 10% of the population. So if we look at your side profile here is this. This is 5 is actually here. 5, 4, 3, 2, 1. Now, this is the sacrum S1. It has taken on the characteristic of a lumbar.
Okay.
So on this segment here, if we want to classify it, it's called a transitional vertebrae. And why that's important is this. This is important for you to hear. And I'm glad you've been doing CrossFit and things like that. The person who has 4 lumbars should be doing more stretching, more yoga, more loosening things up.
Okay.
The person who has 6 needs more back strengthening, more strengthening exercises for the back. So that's actually good that you were doing that. And this is what I'm talking about, okay? Now, here's your 5, and it's pretty posterior. 4 is starting to fuse to 5. Now the idea here is this, look, it is starting to fuse there. You're getting the hook there. We want this to fuse naturally, natural fusion, because that's what the body wants to do. However, we need to get this thing moving.
Okay.
All right. Why that's important, look, we have a little spur coming off the back there. You still have some decent disc there, but what happened there? What you have to be mindful of are squats. Don't be doing those squats, dude.
Deadlifts and all that? Oh.
You got to do free weight stuff. You can't be having a bar on your back, dude.
Yeah, let me see.
Now, if you're doing, I'm just telling you right now, we're going to have to figure something else out to still get your power, but you can't do that traditional stuff, otherwise you're going to pull it out. Okay, for right now. I got a little bit of work to do with you.
Okay.
And then we'll re-x-ray down the road if you decide this is the work you want. Okay, and everything's good. And then you can go from there. I'll give you stuff you can do for strengthening. Okay, but right now I need you to see this. This is going to fuse naturally. Okay, whatever it is. This is the one we need to work on, L5.
Okay.
All right? Now let's go back over to, actually let's go to the pelvic analysis. And this is the ilium analysis. We're going to put our dots. Now we would do this when we had paper x-rays back in the day, you know, before all this digital stuff came out. But this program happens to have the Gonstead ilium analysis. And we're going to go ahead and do placing dots on the top of the iliac crest. Now, this is typically where the sacral alas would be, so that's where we're going to put them. S1 tubercle or S2. And we can go on S1 tubercle right there, or S2 I should say. We go to the lateral borders of the sacrum. We go to the top of the iliac crest, both sides. We go to the center of the pubic symphysis, or the pubic bone. We go to the inferior border of the ischial tuberosity, or that bone you sit on, you know. I'm using both terms, and it's not so bad. We do have a slight short leg on the right side, 5 millimeters. Anything under 7 adjustments will hold. If I work on the pelvis first, it goes down to 6, it's still under 7. We have a slight rotation of the sacrum, 1, PL1. That's not a lot there, okay?
Okay.
So overall, I'm actually kind of impressed with this foundation. The bigger issue is there something going on in the tailbone? Let's go back. And again, this is the transition here. Maybe there's something there, right there. There's a little swollen remnant disc right there. There it is. I may work on this once or twice. I don't know until I examine you, but that's the real culprit, okay?
Okay.
And I think we're going to have to get to a point where we can get on the knee chest table for you. Alright, let's go back to this. Let's go back here. And let's explain the x-ray. So, the slight short leg on the right, it deviates the spine slightly to the right. It comes back to neutral. As we go up, it deviates again slightly to the right. You had some injury here in the upper back, and I can see a nice side slip of T2, and it's not posterior, it's shifted laterally. So it shifts laterally and it's taking your neck off to the right side. You see that?
Yeah.
Those are your implants, by
Yep.
the way. Yep. The atlas is still there. Atlas is good. The dens is, I can just barely see the tip of the dens. Jaw we'll check later. That's not a priority right now, is it?
No.
And we do have a little bit of that deviated septum there if you want me to deal with that later. Okay? You can see that right there. Okay, that's cartilage. That's the nasal bone, that's the cartilage. So it's the cartilage that's deviated a little bit. Any of your breathing affected? Sinuses? There's a
Yeah, you know, I noticed my sinuses get really bad when I get a cold.
More on the right side? I'm going to assume they're right, and the reason why is if we look here, I can see through this side here, the nasal passage and the conchae. On this right side, I see more congestion. Okay, it's deviated this way, so it's deviated like this. And for whatever reason, it's blocked here on this side.
Okay.
So we'll deal with that stuff later for you, okay? Does that all make sense?
Makes sense.
All right. You're going to have questions down the road. Please, at any point, you ask me, okay? Shall we get started?
Let's go.
Let's do this. Let's see, you got the Habra wiggle or what?
The La Habra.
Let's see if you got the La Habra wiggle first. You're going to walk to the corner of the room in the back.
Cool.
All right. Just normal walking. And the first thing you will see is he tilts to that right side a little bit. And he doesn't actually have the wiggle. He has the shift. He's got the, it's like this.
Shift, huh?
He shifts to the left side. He kicks his left leg out slightly. The right leg plants decent, but because the right leg is slightly shorter, it hits first and then it kicks that left leg out. Okay. Come over here and have a seat, please. Let's start with scoping, starting at the base of the neck. Head down, please. We're getting up top, 10 points, C1. We're getting the base of the neck, C6, C7. The back is clean today. So today's lesson in the case here is transitional vertebrae, 5 versus 6 movable bones in the lumbar spine or the low back. Today's lesson is going to be talking about and working on plantar fasciitis or plantar fasciitis. And that's coming from where? That's coming from improper foot biomechanics. And we got 6 points right there, down low. It's not a lot. But we are going to probably start down in the sacrum, okay?
Okay.
I'm getting 1, 6, 7, and down low in the low. Feet together. Oh, I'm not supposed to use a chair now. Feet together, open and close the knees, open and close. Right side only, please. Right side only. When he does the right, the left is fine. Left side only, please. Surprisingly, you got to see this. Follow the thumbs. Right side. The pelvis is fine. The other take-home message is what? You had an MRI of the lumbar spine, right?
Yep.
You needed a full spine approach or a full spine analysis, guys. I mean, the full spine analysis would get an accurate count. And the accurate count tells us what the real picture is, what's really going on. And as you see here, I'm running my fingers down the spine, the swelling starts there. That's the edema and swelling in the back. It pulls all the way down to the tailbone right there. More tender there or there?
There.
Down in the low.
Yeah.
Oh, there you are. There you are. So one of the things is an accurate count. You didn't do any traction or inversion table or any of that stuff?
You know, I had an inversion table at the office before and barely used it.
Why is that?
You know,
I'm just asking, I'm curious. I'm not a fan of it, but I'm just asking.
I don't know. Oh, that's tender.
That's number 4, dude. Yes?
Yeah.
C2, C2 left side, there. And C7 is there, and that's T1. T1, C2, S4. So what we're going to do today is formulate a game plan for today.
Okay.
We'll start with the tailbone, T1, C2. After that I'll have you walk, and then we may start on the ankle today.
Okay.
I'll tune up your shoulders and all that stuff too. Okay?
Sounds good.
You got it. You ready for me?
Let's go.
Let's do it. Let's get a listing of T1 and C2. Let's see if we can justify them. So, if we look at T1 is a PLS, C2 is a opposite. We're going to wait on C2. We're going to do T1. Now, we said T1 is over a side slip T2, so I got to reevaluate this. Hold on. That's why the x-ray is so important. Head down, please. You feel that?
It's not that bad.
Tender? Not that one. That one.
It's a little bit tender, but
You can deal with it, right?
yeah.
So here's what's going to happen. I got to go with where the nerve pressure is, okay? I'm going to correct myself. 7, not T1. C7. You ready?
Let's go.
Let's go. Left ear. Left ear down. Good. And that's the whole line. Nice. Let's walk that off once. And we're going to go face down on the gray table. So we're down on S4. We got a torque counterclockwise. And we're going to do counterclockwise torque because of the dropped sacrum on the right. Oi! Relax the shoulders. Oh no. He's going to get tough. You're going to make me work today, bro. Come over here, let's go left side down. You're going to make me work today.
Wait, left side down? Oh.
Uh-huh. Hold there. Just light and easy. Let it roll. That's a baby one. Let's walk it out, dude. Nice. Walk it out. Oh, we got work to do. There's a chisel. It's a little different.
Yeah.
Now, let's go face down over here. You've seen this table, right?
That's the one I don't like.
It's the Bentley, dude. Come on. Nice and easy, brother. Nice. Nice. Relax the tummy. Tummy up, up, down. Gotcha. That's a piece. Come up slowly. One more. Let that drop. Let the chest drop. There you go. Gotcha. Nice. Come up slowly. That's the worst of it, okay?
Cool.
That's it. Walk it out. As you're walking, tell me if anything is different.
I can't explain it, but there's difference.
Can you sit on the floor?
Can I sit on the floor?
Yeah, sit on the floor.
Like,
However you sit. That's not the test. The test is to get up fast and see if it's a little easier.
yeah. It's not as stiff.
Okay, one more time. Cool. But you understand what I found there, right? You understand what I explained there?
Yes.
Okay. Okay, have a seat. Let's continue. Let's recheck. Starting at the base. 7 is clear. 2 is clear. Right now, I need you walking 10,000 steps a day. You can swim, you can hike, you can bike, you can do elliptical with the handles. I don't want weights, and CrossFit for at least 2 weeks, dude.
Okay.
Deal?
Done.
You remember what S4 felt like? Remember what it felt like back here?
Mm-hmm.
Alright, check it out. 1, 2, 3. That's the one. A little different?
Yes.
Alright. Ears. Shoulders, drop it. Let me have it. Shoulders, drop. And now let's work on the foot. On your back over here, sir. Tender.
Oh, very.
Remember I told you about ankles, talus?
Yeah.
Mira, check it out.
Oh.
They're both tender. You have sprained your ankles. I'm not talking about today, I'm talking about a long time ago.
Probably.
Yeah. We've all sprained it at some point. 90% of us have sprained an ankle. So let's start by working that talus. See if you can handle it. You want to see a groomer and cry? I'm joking. But you can tell them what it feels like. I got to break up that scar tissue, dude.
Yeah. Yeah, you can feel it.
You know? What is it? It's scar tissue.
I have a high tolerance for pain though.
No kidding.
Oh.
5. So we're working the periarticular swelling. You can even see this cuboid is, how's that when I push there in the cuboid?
It's okay.
High pain threshold.
Yeah.
Okay, let's go through the alignment, okay?
Okay.
We're going to start with the talus. Raise the right leg. Fibula. Turn to the side. Posterior lateral calcaneus. Turn to the other side. Let's do the arch. Face down on your stomach. There's your right leg. And plantar fasciitis comes off of, you feel that? More here or more here?
Towards the back of the foot.
You can feel this actually. Let it go down. Let's do the second. There you go. Let's walk that off, dude. You can put your sock on.
First thing I notice is there's no pain.
Tag one.
Like I don't feel anything in my heel.
Tag one. See the paid advertising? A little different, right?
Yeah.
Okay, jokes aside.
Definitely.
Let's check out the hands. Come over on this side, please. Squeeze. Squeeze. Everyone is a different case, okay? And everyone is a different treatment, or I don't want to say treatment, different game plan.
Okay.
You know, and people move, their bones move differently, their alignment is different. In your case, we're not getting those big cracks in your back. They're moving. And as we're breaking up some of that, as we're remodeling some of that scar tissue, we're able to get through it better. Squeeze. Relax there. There you go. Squeeze. Nice. Squeeze. Questions with anything I went over, did, or found today with you?
No.
All right. So that's where we're going to start. All right?
Yep.
Welcome to the office.
Thank you.